morning, everyone. Good morning. Good morning, Roz. It's beautiful Saturday morning. We're here with another amazing episode of Weekly. I'm Comedienne Joy, your host, and I'm joined by my left, Dr. Mia of Me Wellness, and then we have Dr. Cree on my right. We got one of my favorite things, some self-care, but we're going to go around the room and see how everybody's. And good morning, ladies.
Good morning. We'll let Dr. Cree go first. Everybody should know who I am by now, but let's let Dr. Cree go first. Let her introduce herself to the people, even though most of them probably know her anyway.
Most of them know me. Thank you, Dr. Mia, for having me. And good
she
morning.
Has this
Go ahead. You waiting for me?
Good morning, because you do this amazing event called Wifeology. I want you to tell us more about it, and I got a question about this event, Wifeology.
Mm-hmm. Well, I'm Dr. Cree. I'm a board-certified family medicine physician, and I specialize in helping everyday overwhelmed, overworked women learn to live a healthy, happy, whole life. And in that balance, or if there is one, and self-care is always on the top of our agenda. So thank y'all for having me, and we'll jump in with Wifeology. You don't want to jump in there now, Dr. Mia, or do you need to remind them who you are?
Well, let me go and tell y'all who I am, people.
Okay.
It's Dr. Mia, your B3 specialist and board-certified gynecologist at Me Bella Wellness Center. Y'all know our focus is to help you live well, age well, and experience everlasting intimacy through our wonderful Me Bella Wellness solutions. So, yeah, let's get into it.
So Wifeology, I started Wifeology about 6 years ago. And
I want to know more about this Wifeology event.
Okay, more about it. So we started Wifeology, and I was seeing so many women in my clinic who were overworked, overwhelmed, and the recipe seemed to be a prescription of sorts, seemed to be rest. Like, listen, can you just take a couple of weeks off of work, bring me them FMLA papers? And they came back so much more renewed, less anxiety, less stress. The blood pressure was a little bit better. The depression was better. The anxiety was better. And I'm like, if I'm seeing so much of this in my private practice, there has to be a lot of this in the real world. So we started the event in Birmingham. We had about 25 women get together, and it has grown every single year since that time. So this year we'll be in Nashville. It's completely sold out in June, and we just leave our kids at home. Who cares who has the kids? We leave the husbands, and we just get out and about and let loose. And it's been a blessing to a lot of women.
So let me ask you this, Doctor. Do you just have to be a wife part of this? Because I'm not a wife, but I'm stressed, and I definitely believe in some self-care.
So yes, for our platform and for this particular weekend, you do have to be a working wife. That's who I focus on because that's where it was birthed out of. But I'm sure there's some events out there that helps the everyday woman as well. But Comedienne Joy, if you want to get us on the bus and take us around, then you can be a part of that action too. We'll just act like we don't know that you're not married.
So I have a question.
It's for me.
So Dr. Cree, I think yours going in and out a little bit, Comedienne Joy.
Mm-hmm.
But Dr. Cree, the other thing I want to talk about is just normal self-care and being healthy. So most of the people we're talking about, they're usually in their 30s to their 40s. So, I deal with the women who perimenopausal, their hormones are acting up, all the things. And what I tell them is I can help you with this part, but there are some things that you need to be doing in general, just for your normal self-care as far as prevention and screening. Can you talk a little bit about prevention and screening that women over 35 to 40 should be doing, and the importance of maintaining a healthy blood pressure, good blood sugar levels, and cholesterol levels?
Mm-hmm. First of all, women in their 30s and 40s, you do need to start seeing your primary care doctor. If you don't have a primary care doctor, then off base, you are not doing what you need to do from a self-care perspective. Stop asking Dr. Mia to refill your blood pressure medicine.
Exactly.
She don't want to refill your she don't want to refill your medicine. She don't know nothing about that. She's just like, I'm here for these hormones. I'm here for all of that. So first things first, get you a primary care doctor. And you need to be going to them at least yearly. If you're on blood pressure medicine, if you're diabetic, if you're pre-diabetic, you probably need to be going more frequently, which is maybe even every 3 to 6 months. You need to be getting your mammograms, getting that baseline mammogram at 35 years old. If you don't have a uterus, you may not be seeing your GYN as regular as you were when you were in your 20s. So a lot of times I'm that first stop. I may be seeing you before you seeing Dr. Mia. So it's my job to remind you, hey, at 35, you need your baseline mammogram. And then from there, you need your yearly mammograms at 40, or do you have a family history of breast cancer? Let's start getting those. At 45, we need to get your colonoscopy screening. So these are some things that we should be doing. I'll be checking your cholesterol. We'll be talking about family history. A part of your self-care is knowing what's in your bloodline so we can know what to prevent, we can know what to look for, we can know what to screen for. So I'll be checking your kidneys, your liver, your blood sugar, your anemia levels, especially if you're still a menstruating woman. And we just gonna just do all those things before you get over to Dr. Mia to say, I'm tired, because they come ask me about their hormones. I'm like, I don't know nothing about no hormones. Let me check your kidneys, let me check your liver. I do know that Dr. Mia knows that, so go see her for that. So we're in partnership. So your basic health is your number one self-care.
Mm-hmm. Mm-hmm. And the other thing, I'm glad you said that about mammograms, because
So a lot of times,
go ahead, Comedienne Joy. Go ahead, Comedienne Joy.
yeah, I was just going to say a lot when we think about self-care, we start to think mental. We start to think, oh, I have too much to do, or I don't know how to do it. But both of you all are saying your physical health is where it's, and from there we can work on those other mental things that also is part of, that's part of the self-care process.
Exactly.
Mm-hmm.
Exactly. Yes. And then the other thing I wanted to reiterate is the mammogram. So getting that baseline mammogram, y'all, I have had a couple of women before the age of 40 that I just encouraged to get their baseline mammogram, and they already had breast cancer. Yes. They didn't feel it on their self-breast exam. So not only do we want you getting your baseline mammogram, and I usually like to send you to a specific place like Camilla, and I like to send you to Camilla because she's going to let you know based on your family history, your personal history, what she finds on that mammogram, how often you need to get the mammogram. Some women can wait until 40 to get them every year, but some women, based on their history and family history, need to get them more frequently and start earlier. But I have had 2 or 3 women this year to be diagnosed with breast cancer before the age of 40. So had we not pushed that baseline mammogram, they probably would have had a higher stage breast cancer, and that would have decreased their survival. So get your mammograms. And the other thing, Dr. Cree, is people just don't take the time. Like what I'm finding in my patients, I'm like, so when was your last mammogram? It's been 2 or 3 years ago. They over 40. They have insurance. They're educated people. They know that they're supposed to get their mammogram. So what is it that we can say to these women about missing their mammograms, missing pap smears? Like no woman in America should ever get cervical cancer. If you get cervical cancer, more than likely it's because you are not getting your pap smears regularly. So what are some things that we can do, Dr. Cree? What are some things that you teach at that Wifeology conference to give us to make us realize the importance of putting ourselves first? And that's what my whole month of May is about. It is okay to prioritize yourself. I am more important than a lot of people. And to me, I'm very important. And it's okay for me to put myself first. Can you speak on that? And then Comedienne Joy, I want you to speak on that as well.
Yes, it is definitely okay to put yourself first. At Wifeology, we talk a lot about getting your own calendar, a calendar that's specific to you and your needs. Like we got all our kids' stuff on the calendar. We're not missing any recitals. We're not missing any gymnastics. We're not missing any jack and jill. We're not missing any of those things. But then we'll put our stuff, we'll reschedule us for later. But we're not going to miss mama's appointment because a lot of us are in that sandwich generation. We're taking care of our parents as well as taking care of our kids. So that can be even harder. So making sure you're keeping your calendar. And when you walk out of that appointment, I go to Camilla Imaging. I shout out to them. They give you your results on the same day. But when I get to the front desk, I go ahead on and make my appointment for the next time. Because leave it up to me, I'll look up and it's like, oh, it's been 2 years. It's not going to ever be 2 years because, I'm going to go ahead on and make that appointment. And do that for all of your appointments, whether that's your massages, whether that's your therapist, Yeah, whether it's your nails, whether it's your Botox, whatever it is, go ahead on. I don't leave any place without going ahead on and making my follow-up appointment because I don't trust myself. I don't trust my schedule. So make your own calendar. That calendar says, Cree, this is all things. And then I add my family to it to say, I'm not available to you on these times, on these days. And when you normalize that, they will not bulldozer through your schedule because they're like, well, it's Friday. You off. You should be available. No, no, no. I'm only available to me on Fridays on my off day or on Mondays on my off days, whatever that is. So you have to set that boundary. So we talk a lot about boundaries. We talk a lot about prioritizing ourselves, and we talk a lot about saying no. In that you may have to say no to a meeting on that day because you got your mammogram already scheduled. We're not going to reschedule our mammogram just for this routine meeting. So in prioritizing ourselves, sometimes we have to say no.
Just say no.
Mm-hmm.
Comedienne Joy.
So one of the things, yes. So one of the things I try to do, so one of the things that I try to do is not feel like old people and have to go to your on Monday, this dentist on Wednesday, see this person on Thursday. I try to schedule my on the same day. So you're going to see the top part of me in the morning, bottom part of me in the evening, and that way we can get it on. I just remember like my parents, my grandparents, oh, I got to go to this doctor here, this here, and, you know, I'm doing is going to the doctor. That made me feel like old people. I don't want that's a priority. Right. So I schedule them on the same day so that we can take my other time and go do something fun. So that way I feel rejuvenated.
That's right. Mm-hmm. And remember, when y'all scheduling all those appointments on the same day, it's a new day in medicine now. Don't expect to go to your appointment and get out in 30 minutes. It's probably not going to happen. Okay. The whole world is short. So make sure you give yourself a couple of hours at each place so you have time to get to your next appointment. You're not paying those no-show fees because everybody charge for them now. Even when you go to the wax lady, she's going to charge you for your whole wax if you miss that appointment. So make sure you're scheduling appropriately too, putting some time in between your appointments so you can make them all. And exactly like Dr. Cree said, make your appointment before you leave. That's what we do at Me Bella. We make sure that you schedule your next annual while you're there. Even if we have to change it, that's fine, but it's at least on the schedule to remind everybody what we need to do. And then we also talked about that colonoscopy. I do want to reiterate, it's a lot of women. The Cologuard is not for high-risk people, meaning if you are Black, the Cologuard is not the screening tool for you. We are automatically high risk at everything. At 45, get that baseline colonoscopy. If you have a family history of colon cancer, get it 5 years before that first degree relative was diagnosed, and get your colonoscopies every 3 to 10 years based on your history and your family history. But a Cologuard does not replace a colonoscopy. Colonoscopies prevent cancer because they remove benign polyps and keep them from turning into cancer. You cannot get that with the Cologuard. Can you speak on that a little bit too, Dr.
Yes,
I got all these women telling me they came and got their Cologuard, and I'm like, I don't care.
Yes, exactly. I have lots of people that, so in my practice, I push the colonoscopy is the gold standard at Brownstone. We like, you got to get it. But I even push them to say, can we do it 10 years before your last relative? Because I'm like, we also chat with Bozeman, and everybody was surprised that he died of colon cancer. And I had a friend, a doctor friend, and she was just in her early 30s, and she died from colon cancer. So you can't look at people and tell. Sometimes the symptoms are you used to being constipated, you used to having stomach aches, so you're not thinking any of it. You got hemorrhoids, so you used to seeing blood in the stool, so you don't know that, hey, this is something different. We have all of those things. And the idea of saying, I'm just sure I don't have colonoscopy, I feel like I don't have colon cancer, I feel like I don't have, like, don't do that. We're not going off our feelings, we're not going off what we think. Get that screening. Yes, you have to drink the stuff. No, there's no better way of doing it right now. And even if you do the Cologuard, if the Cologuard comes back positive, you're still going to have to end up getting a colonoscopy anyway. So I have some people, I can't twist their arm. I'm begging them to get it. If I have to send them for the Cologuard, for me, that's better than nothing. Right. But I'm still pushing to say, hey, you have done it, but let's still get that colonoscopy. Because truth be told, we don't know all our family history. We know grandmama died, but we don't know what she died from. She had some kind of cancer. So just because we don't know what kind of cancer grandmama had, we probably need to be doing early screening and early detection for all of them.
Mm-hmm. 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 Mm-hmm.
And the good part is when it's over, you can go to Waffle House and get your food smothered and covered because I know you're going to be hungry. Also, schedule a colonoscopy as early as possible so you're not waiting until 2:30 to get this appointment and you're starving because the night before you're going to be asleep. Get it early and you can eat and pack that colon back up.
Yeah.
No Waffle House, do we, Comedienne Joy? So let's talk about a little bit about the transitional phases. Coming from the primary care standard, what I notice is that women tend to get heart disease, women tend to get breast cancer, women tend to get all of these diseases once their peri and postmenopausal hormones have changed.
Mm-hmm.
Can you talk a little bit about heart disease and screening? Because I think there's one screening that a lot of women are just not getting. And what I say is if you get your ovaries removed at an early age, start your cardiac screenings early because the lack of hormones increases the risk of heart disease. Can you just talk a little bit about heart screening, cardiovascular health, and what we should all be doing as women to protect our heart? Because the number one cause of death in the United States of America is heart disease.
Heart disease. That's a really good point. And we're not thinking about it when you're going through menopause. We all are perimenopause. We're only thinking from the waist down, and add hot flashes. Nothing else. You're not talking really. You're not concerned about anything else because we don't see that those arteries are clogged. We don't see that all of that. And then also Dr. Mia to add on the transition plus the family history. So I think as a good clinician, I started to have the conversation of, oh, heart disease runs in your family. How old was your mom when she had her heart attack? Oh, she was 55. Oh, you are already 40. Let's go ahead on and get in with your cardiologist. So I tend to be a little bit more proactive in that. I don't say we just gonna talk about your family history. Let's go ahead on and get over there. Let's go ahead on and get the cholesterol checks. Let's go ahead on and do the chemistry where we're checking your sugars and all of that. But then also let's get over there so you can get that EKG. You can get that baseline echocardiogram. We can get these baseline tests just because one, it runs in your family. So if we're looking from a family history standpoint, we already got you at the if you're paying attention, we've already got you to your cardiologist. So that when you hit that transitional phase, you're already there. And then you can already go ahead and start that little baby aspirin, to get that little 81 milligram, make sure that's fine with all you got going on. Go ahead and start all of those things. And when your doctor say you need cholesterol medicine, take it. Don't argue. Don't say I don't need it. And then your numbers a little high one year, you go through menopause and they super high the next. And then you're like, but I'm working out. But I'm not losing weight. All these complaints that we get, especially as we transition. So making sure you see your cardiologist, making sure you exercise, making sure you're watching not doing such an American diet and watching the fat in your diet and being mindful of that family history even before we get to our transition. So that Dr. Mia is not looking up and saying, what is happening? What is your primary doing? Oh, they told me about it. I just didn't feel like I needed to go do it.
Mm-hmm, mm-hmm. And blood pressure. Why I got all these Black women coming in my office who going to see doctors and they walking around with high blood pressure and they say their doctor told them it's just hard to control their blood pressure.
I'm sorry. That is crazy in that. So let's talk about high blood pressure. So the definition of hypertension, and we don't like to talk about it, is just two levels of elevated blood pressure. There's over 140 on the top, there's over 90 on the bottom. Simply two. So if you come in today and you come in 3 months later and it's still up, you got high blood pressure. And a lot of that is, I'm making a recommendation of let's go ahead and start you on some low dose medications. Some medicines that won't bother you. Take it before bed, and then you come back and say, I read the side effects, I didn't like it, so I didn't even take the medicine. So you're like, okay, after you do that a couple of times, any clinician is going to be starting to write non-compliant patient. So when you come back and you've had that stroke, you've had that heart attack, you've had those events that you could have been preventing, or kidney failure. Remember, high blood pressure starts in your kidneys. We got so many African Americans that's on dialysis And the issue is you're not doing what you needed to do when we told you from the beginning that you have high blood pressure. No, 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 no. I got pre-high blood pressure. Just check it again before I leave. Just check it. So I have my team. We check it digitally. If it's up, check it with the old-fashioned cuff. I tell my African American people, especially if we got a little thickness in our arms, no, don't take that first reading. Hey, bring me the old-fashioned cuff so I can really see what my blood pressure is. And then check your pressure at home. Or if you don't want to take it at home, there are all the fire stations all around Birmingham in your city. You can go there and they will check.
So
Go ahead.
So let me mention about taking your medication how does that affect your reading or your pressure taking it at night versus taking it in the morning?
So sometimes if you're taking it at night, your levels may be higher in the morning. So that's my job to say when you come in, if it's early in the morning and you still have it, you took it at night, I'll tell the patient, let's change it. But in the beginning, I usually say take it at night. So if you're going to have some side effects, that will happen during the nighttime. So when you come back at 2 weeks, at 4 weeks to follow up on it, you should be checking your blood pressure at home as well to say, hey, here's my log now, doc. I checked it this morning. It's looking good in the morning. By 3 o'clock, 5 o'clock when I get home, it's back up again. So then it's my job to change the time of the day. But I can't do that by myself. And also, people just don't take their medicines before they come to the doctor. They're like, I didn't eat yet. Like, okay, eat a cracker and take your medicine. In the Black community, we got this thing where they say, well, I just never take my medicine before I go to the doctor. Well, how are we supposed to know whether to treat it, whether to increase your medicine, whether to decrease your medicine? So Comedienne Joy, that's a good point. We need to have our own cuffs at home. We need to be our own advocates. Show me. If you like, I've been on this medicine for 10 years, I want to come off of it. Show me. And I got the proof. Okay, then let's back off of it. Or no, it's not working. Help me because I'm only getting a snapshot when you come right there to the visit.
And then too, Dr. Cree and Comedienne Joy, I always remind them too that, you know, secondary to the slave trade, we are just predisposed to high blood pressure. The only people who could survive on that ship for all of those days without food, without water, were the people who were already selected out for salt retention and high blood pressure. Yes. So it's genetic. You can be exercising every day. You can be a normal weight. You can be healthy. You can be granola, and you can be trying to do all of these herbs. But if you have high blood pressure, it is the silent killer. You have to treat it, and you need to keep that blood pressure less than 125/85. Period. Point blank. Black folks just got high blood pressure. Some white
medicine.
So just take your medicine. It's not one of those things you can just decide that you want to be natural at this point and not take your blood pressure medicine because you're going to have a stroke or a heart attack. And that can. So I think this was a great conversation because we needed to remind people the importance of putting.
So are you saying just take the medicine?
Go ahead. Go ahead, Comedienne Joy.
Yeah, I was trying to ask, are you saying just take the medicine even? Yeah, so we want to just take the medicine so the numbers don't more elevated. Because even I've now switched to taking my medicine and the numbers are better, but I still don't have but obviously it's better than it being.
Yeah, you kind of going in and out. I think you said when you take your blood pressure, sometimes it's still slightly elevated, but when you take your medicine, it's not as elevated. But that may mean that you need to do some journaling, like Dr. Cree said, of your blood pressure. And if it's still over the 135/85, then they may need to do some dose adjusting for your medication.
Correct.
But you can't just ignore it because, you know, you don't want to take medicine. We got to take some medicine sometimes. And a lot of times it's high blood pressure medicine.
Exactly.
So, yes. So we want to thank everybody for joining. We thought it was important. It is Mother's Day month. All these wonderful mothers, whether you are a mother biologically or whether you just loving on somebody else's children or your nieces and nephews and taking care of people, what we want to remind every woman this month is to focus on yourself, figure out how to prioritize your own health so that you can love on everybody else and take care of everybody else. Because when you don't have yourself together, you're not going to be able to take care of your family the way you want to. So your health is your wealth. Put yourself first. It is okay to be selfish. I am totally fine with people calling me selfish because I put myself first, because I know I'm a better mother. I'm a better wife. I'm a better doctor. I'm a better friend, daughter, sister, all of those things when I put myself first and take care of myself. So it's okay to be selfish and take good care of yourself. So now we're going to go around and everybody's going to remind the people of what they have going on. I'll start. Take us out of here. She'll end. So again, I'm Dr. Mia at Me Bella Wellness Center. You know, we offer weight management, hormone pellet therapy, intimacy services, laser hair removal, and total wellness with supplements for men and women. But of course, we offer gynecology to women and adolescents. I have an amazing team at Me Bella. I have 2 amazing nurse practitioners who help me see patients. My goal is to see every patient, especially for gynecology, throughout the year. So I'm always coming in the room, and I'm not going to let anybody take care of y'all that is not going to do a good job. So if I'm letting them take care of you, know that it's because they're going to take great care of you. So at Me Bella, we offer all those services. Schedule your appointment if you're not up to date on your gynecology. And make sure, y'all, when you find doctors who care about you, who take care of you, who listen to you, and make sure that you get those screenings and do those preventive measures that you need in order to live a life of total wellness. Dr. Curry, tell the people about yourself, girl.
All right, then. Thank you for having me, Dr. Mia, and it's been always great catching up, Comedienne Joy. I am located in 2 locations. I'm in Trussville. My office is Brownstone Healthcare. We do direct primary care where you can get all of your primary care needs at a low price of $70 a month. That's whether you have, if you're insured, you're underinsured, or you have no insurance. You can text me directly. So we have take the middleman out. You still use your insurance for labs and for your referrals. So I'm here for that. And I also am the medical director for the City of Birmingham Employee Health Clinic. So if you work for the City of Birmingham, you can come to either of our locations at no copayment. You can find me at, my Facebook got hacked, y'all. So go run and follow me on Facebook at Dr. Cree and me. And we do all the primary care updates over there. Thank you.
Thank you, Dr. Cree.
And then I'm Comedienne Joy. I do all your mental health things. I have my food. I have local restaurants in 4 hours. We have small bites and adult beverages. Also have distillery tours, brunch tours. So I've been doing a lot of corporate events here lately. So if you want to take your team out during the day, let me know and we can arrange that for you as well. And if you want to get away and travel and go see the world, eat some bad stuff, but you can still work out because there's a gym, because I got these 2 doctors on here to say, wait a minute. You can do that as well. And you can follow me on the website with everything I do at comedienjoy.com. Yes, and I'll be seeing Dr. Mia real so that way I can get my pellet and stay energetic. And yes, when I become a wife, I'm going to go to wifologist. So I'm going to go to the husband store.
Right. And y'all got to do that bus with Comedienne Joy. She is amazing. Dr. Cree is my doctor. Like, we each other's doctors. So
exactly.
I definitely love the direct primary care with Dr. Cree because it saves me so much time. And time is money. So the fact that I can just kind of call her up, stay on her schedule, is very affordable, all the things. So y'all make sure y'all check out Dr. Cree. Make sure y'all go do some fun stuff with Comedienne Joy. That's good for your mental health, like she said, and your balance. We got to do that work-life balance. So we got to have some fun in between. I appreciate y'all spending your Saturday morning with us so that you can invest some time into your health and wellness. Me and Joseph will see y'all tomorrow on Ageless Intimacy at 8:30 p.m. Central Standard Time. And we'll be talking about something important that you want to hear. So make sure you show up. It's Dr. Mia. Thank y'all for joining. And I'll see you next time. Bye. Thank you, Dr. Cree and Comedienne Joy.
Thank you.
Bye.
Bye.
Pleasure.